Sequencing of COVID-19. When COVID-19 meets the definition of principal or first listed diagnosis, code U07.1, COVID-19, is sequenced first, followed by the appropriate codes for associated manifestations. For example, when the reason for the encounter admission is respiratory manifestations of COVID-19, assign code U07.1 as the principal first listed diagnosis and assign codes for the respiratory manifestations as additional diagnoses. When the reason for the encounter admission is non-respiratory manifestations, e.g., viral enteritis of COVID-19, assign code U07.1 as the principal first listed diagnosis and assign codes for the manifestations as additional diagnoses. The exception to this sequencing rule is when another guideline requires that certain codes be sequenced first, such as in the case of obstetrics patients or patients with sepsis or transplant complications. People infected with COVID-19 may vary from being asymptomatic to having a range of signs and symptoms of varying degrees of severity. Therefore, for coding purposes, signs and symptoms associated with COVID-19 may be coded separately, unless the signs or symptoms are routinely associated with a manifestation. For example, cough would not be coded separately if the patient has pneumonia due to COVID-19, as cough is a symptom of pneumonia. The additional coding of signs or symptoms not explained by the manifestations would provide additional information on the severity of the disease. When COVID-19 is the reason for admission, encounter during pregnancy, childbirth, or the puerperium, the appropriate code from subcategory 098.5, other viral diseases complicating pregnancy, childbirth and the puerperium, should be sequenced as the principal first listed diagnosis. Code U07.1 and the codes for associated manifestations should be assigned as additional diagnoses. If the reason for admission encounter is unrelated to COVID-19 but the patient tests positive for COVID-19 during the admission encounter, the code for the reason for admission encounter should be sequenced as the principal first listed diagnosis. The appropriate code from subcategory 098.5, code U07.1, and codes for associated COVID-19 manifestations should be assigned as additional diagnoses. Codes from ICD-10 CM Chapter 15, Pregnancy, Childbirth and the Puerperium, take precedence over codes from other chapters, including code U07.1. COVID-19 may present with respiratory signs and symptoms of different degrees of severity, and it may progress to sepsis or severe sepsis. Whether a code for sepsis or code U07.1 is assigned as the principal diagnosis depends on the circumstances of admission and whether the sepsis meets the definition of principal diagnosis. Note the different codes that would be assigned in the following cases based on a confirmed COVID-19 diagnosis along with available documentation of various acute respiratory illnesses and non-respiratory illnesses. Pneumonia due to COVID-19. Assign codes U07.1 and J12.82, pneumonia due to coronavirus disease 2019. Acute bronchitis due to COVID-19. Assign codes U07.1 and J20.8, acute bronchitis due to other specified organisms. Bronchitis not otherwise specified, NOS, due to COVID-19. Assign codes U07.1 and J40. Bronchitis, not specified as acute or chronic. COVID-19 with a lower respiratory infection, NOS, or an acute respiratory infection, NOS. Assign codes U07.1 and J22, unspecified acute lower respiratory infection. COVID-19 associated with a respiratory infection, NOS. Assign codes U07.1 and J98.8, other specified respiratory disorders. Acute respiratory distress syndrome, ARDS due to COVID-19. Assign codes U07.1 and J80. Acute respiratory distress syndrome. Acute respiratory failure due to COVID-19. Assign code U07.1 and the appropriate code from subcategory J96.0, acute respiratory failure. Patient is admitted with pneumonia due to COVID-19, which then progresses to viral sepsis not Present on admission, assign code U07.1 as the principal diagnosis, followed by the codes for the viral sepsis A41.89 and COVID-19 pneumonia J12.82. Patient is admitted with sepsis due to COVID-19 pneumonia, and the sepsis meets the definition of principal diagnosis. Assign the code for viral sepsis A41.89 as the principal diagnosis, followed by codes U07.1 and J12.82 as secondary diagnoses. Asymptomatic patient tests positive for COVID-19, assign code U07.1. Although the individual is asymptomatic, the individual has tested positive and is considered to have COVID-19. Pregnant patient admitted with mild COVID-19 and acute bronchitis, assign the appropriate code from subcategory O98.51, other viral diseases complicating pregnancy, as the first listed diagnosis, followed by codes U07.1 and J20.8 and an additional code for the number of weeks of gestation. Newborn tests positive for COVID-19 during the birth admission without documentation. Specifying the type of transmission, assign first the appropriate code from category Z38. Live-born infants according to place of birth and type of delivery, as the principal diagnosis, followed by code U07.1, and the appropriate codes for associated manifestations in the absence of documentation indicating a specific type of transmission. Newborn tests positive for COVID-19 and the provider documents the condition was contracted in utero or during the birth process, assign codes P35.8, other congenital viral diseases, and U07.1. Patient is admitted with non-respiratory manifestation, e.g., viral enteritis due to COVID-19. Assign code U07.1 as the principal diagnosis, followed by the code for the non-respiratory manifestation, e.g., A839, other viral enteritis. Patient status post-lung transplant contracts COVID-19, assign code T86.812, lung transplant infection, followed by code U07.1. Patient with sickle cell disease (SCD) presents in sickle cell crisis (SCC) triggered by a COVID-19 infection. Assign the appropriate code from category D57, sickle cell disorders, for the SCC and code U07.1 for the COVID-19 infection. Sequencing would depend on the circumstances of the admission. While the COVID-19 infection triggered an acute sickle cell crisis, SCD is not a manifestation of COVID-19. Patient is admitted with multisystem inflammatory syndrome and COVID-19, assign code U07.1 as the principal diagnosis, followed by code M35.81, multisystem inflammatory syndrome.